Good morning, everyone. Welcome to the Colorado Health Foundation Pulse Poll briefing. We're really excited to have everyone with us this morning, and we have a lot of folks registered, and I see participants logging in as I'm speaking. So we're going to give everyone another minute or so to go ahead and get settled. And for those of you who have joined us and are ready, we invite you to share your name and your location in the chat, just so we get a sense of who's with us today. And we'll go ahead and get started here in another 30 seconds or so. Welcome, Amber. Hey, Julie. Again, welcome everyone to the Colorado Health Foundation Pulse Poll briefing this morning. We're thrilled to have so many of you with us. We have a lot of exciting data and findings to share with you today. So I do not want to delay on our timeline and keep moving through our agenda. As you get settled with us, please share your name and location in the Zoom chat. Give us a sense of who's with us and where you're zooming in from this morning. And you've got lots of folks doing that already. Thank you. Okay. We are nearing almost 100 of you with us. So I think I'm going to go ahead and get moving with our agenda. Again, welcome everyone this morning to the Colorado Health Foundation Pulse Poll briefing. We're thrilled to have you with us. Please share your name and location in the Zoom chat when you're ready. And I'm going to go ahead and get us started. If we can move to the next slide on a little bit of information about our commitment to language justice here at the Colorado Health Foundation. We are joined by our language justice partner, Community Language Cooperative. We have Alejandro with us from CLC, and Alejandro is going to share just a little bit about some live Spanish interpretation that we're offering during the event this morning. And Alejandro, if you're ready, I'm going to turn things over to you.
Thank you very much. Hello, everyone. Thank you for having me. My name is Alejandro Arrieta. I will be the Spanish interpreter in this space. Thank you for your patience as I provide instructions for Spanish speakers. Hola a todos, gracias por tenerme aquí con ustedes. Mi nombre es Alejandro Arrieta, seré el intérprete el día de hoy. En este espacio sí queremos que puedan escuchar en español también. Si el idioma de su corazón es el español, después de estas instrucciones verá un icono terráqueo en la parte inferior a mano derecha en su pantalla. Si no ve ese mundo de la interpretación en su pantalla, busque la opción de la interpretación bajo el menú con los 3 puntitos que dice más y ahí podrá seleccionar el español. Muchas gracias. Thank you very much.
Thank you so much, Alejandro. And if we can move to the next slide, that would be wonderful. And before we get too much further into a little bit of an agenda lineup, I want to remind all of our attendees, this morning we're going to be using the chat function for all of our communication, and there's just a little bit of a trick to it. It's not a regular type of chat like you're used to in Zoom meetings. So when you're sending any communications today, make sure that you're selecting everyone in the chat box so we can see what you have to share. And again, welcome to everyone. Thanks for sharing your names and locations in the Zoom chat. If you haven't done that yet, please do so. My name is Taryn Fort. I'm the Senior Director of Communications here at the Colorado Health Foundation. I am proud to be a part of our Pulse team here at CHF. And I just want to give a shout out to our Community Language Cooperative team. They are an outstanding partner to us as we try to engage our best in language justice practices. And I also want to give a shout out to our Pulse team. We have an extraordinary team of folks who help us put this poll out into the field every year and to share the data just as we are with all of you. So thanks again for being a part of that team with us. So this morning, folks, we have a lot to share with you. We have our research team who's going to go over our latest data findings. We're going to do an interactive tour of our Tableau website and help you all learn how to navigate the data. That website right now, you can check it out if you're interested, is www.copulsepoll.org. And then we're going to go into a moderated Q&A. We're going to try our best to answer all the questions that you have. Please Again, be using the chat function for all communication today. Make sure that you're selecting everyone in the actual chat box so we can see your questions. You can also use the chat function for any kind of technical assistance needs that you might have, as well as comments or other resources that you want to share with the attendees. So you're all muted, your cameras are off, and that's the way it's going to remain for the rest of the event today. We also are offering closed captioning for those of you that might want to use that. So if you want to access that feature, you can click the up arrow next to the closed captioning icon. It should be on the bottom of your Zoom toolbar. And then you want to select show captions. And then finally, we are recording the session today. So if anyone needs to drop off early, please do not fret. We will be sharing a webinar recording as well as the slides with all of you via email very, very soon. And let's go ahead and move to the next slide. I'll share just a little bit of information about the Colorado Health Foundation for any of you who might not be as familiar with who we are. The Colorado Health Foundation is a statewide philanthropic organization, and our belief is that health and well-being can be in reach for everyone. We are headquartered in Denver. I'm in the Denver office right now as we speak, but we work all over the state and collaborate with organizations and communities in Colorado to break down the many systemic inequities that stand in the way of our health and well-being. Our work takes a lot of different shapes. So we are primarily known as a grant maker in the state, but we also invest in policy advocacy, as well as capacity building programs and lots of different types of convening, which of course we're engaged in right now at this very moment. Another area of work that we invest in is public perception research, which is where Pulse comes into play. And I'm going to ask for the next slide to be shown, please. So Pulse. Pulse is the Colorado's largest annual statewide poll that's focused on issues affecting Coloradans' health and well-being. We stood up Pulse in 2020, so this is our 5th year being out in the field and conducting the poll. Pulse has given us quantitative data at the Colorado Health Foundation that guides our funding, it guides decisions that we make, it guides the priorities that we focus on, and it helps us understand what gaps continue to exist for Coloradans across the state. And we do share all of the results with the public as well as policymakers and media. So why do we conduct Pulse? This is a really important question that we get often. We are very committed to being community informed. This is one of the cornerstones that is a part of the way that we work at the foundation. And Pulse at its heart is really an effort on our part to listen to Coloradans and understand how their lives are going, how things are going in the worlds that they live in every day. Another cornerstone of ours is that we serve Coloradans who have less power, privilege, and income. And we also prioritize Coloradans of color in all the work that we do. So with Pulse, and as a commitment to our racial justice, we oversample racial and ethnic groups. As you can see up on the slide, we oversample African Americans, Asian American and Pacific Islanders, as well as Native Americans in our state. We explore the issues that communities of color say are impacting their health and well-being. And we analyze every question by race and ethnicity, as well as across many other demographics, and we make that data publicly available. Because Native Americans that are living in Colorado make up less than 2% of the population, it makes it difficult for us to achieve a large sample size through our probability sampling methodology. So to increase that sample size, we work with lots of different community-based organizations and partners that you see listed up on the slide. And I just wanted to say thank you to them and give them a shout out, because if it weren't for them, we wouldn't be able to provide the data to all of you today that you're going to be seeing very soon. Next slide, please. So I'm about to turn things over to our research team. I do want to give all of our attendees a reminder that we do have one final briefing in our series of data releases this year for Pulse. It's in September, and it is going to focus on Hispanic and Latino results. That event is scheduled currently on September 9th at 5:30 p.m. at the Colorado Health Foundation offices in Denver. It is free to register for this event, so please feel free to do that. You'll see some information closer to the end about how to do that. I now want to turn things over to our research team, which includes a bipartisan grouping of FM3 Research and Newbridge Strategies. Please join me in welcoming Dave Metz and Lori Weigel. Thank you.
Thank you so much, Taryn. Thanks to the whole Pulse team, and thanks for all of you for joining to hear the latest release of data about where Coloradans stand on a number of critical issues facing the state. I'm Dave Metz. I'm a partner with FM3 Research. We are half of the polling team. My colleague Lori Weigel with Newbridge Strategy will be speaking to you in just a little bit. The reason that you have two pollsters sharing the data with you today is, as Taryn mentioned, together we make up a bipartisan team. My firm, FM3 Research, when we poll on political issues and for political clients, only polls for Democrats. Lori and the team at Newbridge poll only for Republicans in partisan races, but the two of us have been working together since the first Pulse poll back in 2020 to make sure that the research is both designed and analyzed from a bipartisan perspective. On this slide, you'll see a summary of the methodology of the poll. In order to have the most diverse and inclusive sample of Colorado adults, we applied the same methods this year that we've used in previous years. We interviewed over 2,400 adult Coloradans across the state. As Taryn noted, we oversampled a number of individual communities of color to make sure that we had enough interviews to speak confidently about some of the differences in opinion across those racial and ethnic subgroups. We also did some additional sampling in Morgan County this year to be able to take a deeper dive into what residents of that particular community think. The survey is conducted in both English and Spanish. And we reach out to Coloradans through a combination of telephone calls, both on landline and wireless phones, and then by sending invitations via email and text message to invite people to participate in an online version of the survey. And it's through the mix of those different methods of outreach that we can get the most diverse and representative sample. I should also note this is a question we sometimes get. Although we have this bipartisan research team, I want to stress that we interviewed all Coloradans, regardless of their political background. That includes Democrats, Republicans, independents, and those who are not registered to vote as well. And they're all represented in this data in proportion to the share they make up of the overall Colorado population. And it is also the case that even though we oversampled certain geographic and racial and ethnic subgroups, the data were statistically weighted to reflect census data for Colorado's adult population as a whole, and the data we share therefore do speak for the views of adult Coloradans with that 2.9% overall margin of error. There's a number of places you'll see where we draw some distinctions between different geographies within the state of Colorado. We've broken the state into 6 regions by county, as you'll see detailed on this map. We look at the Denver metro area and then have individual county level results for El Paso County and Pueblo County. We look at Larimer and Weld counties as a group. And then the balance of the state we divide into the Eastern Plains and the Western Slope. And you'll see a number of places where we do see some interesting distinctions between the opinions of Coloradans in those different geographies. So to start with, I'm going to share some findings that relate to the overall concerns that are at the top of the minds of residents of the state. In our earlier release last month, we focused on some of the top concerns for Coloradans, which focus on the cost of living, affordability, and the cost of housing specifically. And there's no question that those issues, as in recent pulse surveys, are the ones that Coloradans are most likely to name as the most serious problems facing the state. We had an open-ended question where we asked the respondents to just tell us in their own words what they saw as the most important issue facing Colorado. And we grouped and categorized the responses that they gave us. And you'll see the data here that shows you the issues that were most likely to be mentioned. And as I just alluded to, the top concerns are ones that focus on affordability and the cost of living. About 1 in 5 Coloradans mentioned the cost of living or inflation specifically. Another 17% talked about housing costs as their top concern. And you'll see a few items as you move down the list that also touch on the cost of living. Things like healthcare and health insurance, which obviously relate to the cost of healthcare as well. Concern about taxes, which is also a factor in affordability. So together, that suite of concerns are clearly at the top of Coloradans' minds. We then have a group of items that about 1 in 10 Coloradans pointed to: government and politics. These are people basically saying that they feel like government isn't being effective in solving problems or that there's too much political division in the state. And we'll come back to that topic of political division in a little bit more detail shortly. And then issues around homelessness and immigration were also frequently volunteered concerns among our respondents. And just to give you a sense of the way that Coloradans talk about some of these issues, you'll see some examples here of things that people told us in their own words were the most important issues facing Colorado. A lot of them, as you'll see, focus on housing and cost of living. Some focus on issues relating to immigration, which is a rising concern, as we'll see in a moment. And then there was that government and politics category as well, which 1 in 10 mentioned. If you look at the response in the upper right, people talking about the divisions between the state's large urban areas and then the balance of Colorado as a issue of concern for the state was mentioned by a number of participants too. Now, comparing the results of this question to what we saw in previous years when we asked a similar open-ended question, there have been a lot of shifts over the years in terms of the proportion that name a number of these issues. Immigration really shot up in this year's poll. 13% mentioned it this year, only 1% mentioned it in 2023. So that is a big move in terms of that issue coming to the forefront of the public's mind. Many of the other issues around affordability were just as prominent in surveys last year and also in 2022 as they are this year. And then there's a number of issues where we have seen a decline over time. The most striking one, of course, is COVID-19, which was the top concern in our initial poll in 2020, and today isn't mentioned by any respondents as a significant concern. But we've also seen a somewhat receding concern about traffic congestion. Last year, 10% mentioned that. That's down to 1% this year. And then issues relating to the environment, including climate change, wildfires, and water. Those dropped notably as well. Now, it's worth noting that just because people don't name an issue as the most important issue facing the state doesn't mean it isn't a concern for them. And there's lots of issues that simultaneously Coloradans can see as significant challenges for the state. For that reason, we have another follow-up question where we offer the respondents a list of issues facing Colorado and ask them to rate each one in terms of how serious a problem they think it is. We use a 4-point scale of either extremely, very, somewhat, or not too serious. And running down the right-hand side here, you'll see the proportion that rated each issue either an extremely or very serious problem. And that's what we've ranked them by. There's a very clear top tier of concerns here with both broad and intense worries among the Coloradans we talked to, the cost of living and the cost of housing. Those are the only two issues that outright majorities rated not just as a very serious problem, but an extremely serious problem in the state. So that intensity of concern is noteworthy there. But everything else on this initial slide, we have a solid majority that rates it as a very serious problem. There are a couple of issues where we see some notable division with sizable numbers of Coloradans on both ends of the spectrum. And if you look at the bottom of the slide, when we ask about immigration, 37% rate that as an extremely serious problem, but 26% say it's not a problem at all. So that's a lot of responses, a majority that are on either end. Partisanship is a big part of what shapes some of those polarized views. And you'll see that on a couple of other issues on this slide as well. Climate change, there's a large chunk that see it as extremely serious and another that view it as not serious. And the same goes for restrictions on reproductive rights. The issues on this slide are ones that smaller proportions rate as being a very serious problem, in most cases less than half. But I will note if we add in the yellow bars, the proportion who rate them as somewhat serious, every issue that we asked about here is viewed as at least a somewhat serious problem by most Coloradans. So all of these things are recognized as notable concerns. There's just variations in the strength of feeling behind some of them. One of the items we're going to come back to in a few minutes is the distinction between how voters view the issue of crime as a general principle. You may recall on the previous slide, we had crime listed here, and crime in general was rated a very serious problem by about 3 in 5 Coloradans. But when we ask it slightly differently, as you'll see at the bottom of the slide, as crime in your neighborhood, the numbers are strikingly different and much lower. Only a quarter of Coloradans saying that crime in their neighborhood is a very serious problem. We'll look at the distinctions between those two different ways of talking about crime in just a minute. But first, here's a review of the shift in concern about these issues over the course of the past year. And it's very similar to what we saw on the open-ended question, asking people to volunteer their top concern. Immigration is the big mover here. Only about 1/3 of Coloradans in last year's survey viewed it as a very serious problem, and that shot up to a majority in this year's survey, 53%. So that's a 19-point gain over the course of the last year. There's a few issues that were lower in this year's poll as concerns than we saw last year. Gun violence, which was at 59% in 2023, dropped down to 41%, rating it a very serious problem this year. It's not dramatically different from where it was 2 years ago when it was at 46. So we saw something of a spike in concern in 2023, and that receded this year. The other item that dropped was mental health. 69% rated it as a very serious problem in last year's survey. That's down to 59% this year. But as we'll see in a few minutes, that doesn't mean that the prevalence of mental health issues has reduced among Coloradans. In fact, we see a slightly higher number this year who tell us they have experienced mental health strain. But it may mean that as part of the state's overall conversation about major issues, it just hasn't received the same attention or isn't a focus as much as it might have been in past years, as other issues like immigration have come to the fore and been a little bit more central to recent public debates. So here you'll see over the course of the next couple of slides, some notable subgroup differences in how people rate their concern about these issues. The numbers that you'll see on the table here are the proportion that rated each one a very serious problem. And as we look across at the results across different racial and ethnic subgroups, I think the most striking thing here is that for the top tier of issues, the differences really are pretty modest. When we're talking about the concern about the cost of housing, the cost of living, homelessness, all of those concerns are pretty broadly shared across racial and ethnic subgroups. There are some places where we do see some notable distinctions. When we look at issues like hunger, for example, majorities of Coloradans of color rate that a very serious problem compared to only 37% of white respondents. And when we look at something like police violence and misconduct, only about a quarter of white respondents see that as a very serious problem. More than 2 in 5 Coloradans of color do. So the top tier of issues may be fairly similar across racial and ethnic groups, but there are some issues where we do see notable differences. One of the really striking things for me was how much cost of living concerns cut across different income levels within the state. The most affluent Coloradans, those with household incomes of $150,000 or more, 80% of them view the cost of living as a very serious problem. That's only slightly lower than the proportion among those with household incomes under $50,000 a year, where 91% view it as a very serious problem. So this sort of anxiety about inflation, about the cost of living, really does cut across sort of the entire socioeconomic spectrum within Colorado. And obviously, it may affect different households in different ways, but it's very much a present concern across the board. It also cuts across geographies, as you'll see here, somewhat less expressed concern about the cost of living in the Eastern Plains than what we see in some of the more urbanized areas of the state, but more than 70% across Colorado, indicating that they view it as a very serious problem. And you'll see some issues here where there are geographic differences that I think are a little bit more striking on an issue like climate change, for example, significantly more concern in Denver, the Western Slope, Pueblo County, than what we're seeing in the eastern part of the state. and a number of other issues where we have some geographic variation too. But the biggest differences we see in issue concerns tend to fall across partisan lines. And in particular, there are two issues that really stand out here for having dramatic partisan differences in levels of concern. And that is the issue of immigration, where we see a 59-point gap in concern, 85% of Republicans rating it a very serious problem, right up in their top tier of concerns. But among Democrats, only 26% view it as a very serious problem. The only thing that they rank lower on the list is crime in their own neighborhood at 22%. Climate change, conversely, is a mirror image. It is an enormous concern among Colorado Democrats, with 4 in 5 rating it a very serious problem. In contrast, for Colorado Republicans, fewer than 1 in 10 rate it as a very serious problem, ranking it dead last among Republicans' issue concerns. And independents are somewhere in the middle there on most of these issues. You'll see a few others that are also somewhat polarizing across party lines, issues like gun violence, crime overall, police violence and misconduct, but it really is immigration and climate change that stand out as sparking the biggest divide. So finally, in terms of the overall issues here, we did take a closer look at the gap in between perceptions of crime in general and then crime in the respondent's own neighborhood. And again, the way we tested this distinction was we split our sample in half, with each half of the respondents representing a random and representative sample of Coloradans. For half, we asked about crime in general, for half about crime in their neighborhood. And you'll see more than twice as many Coloradans are concerned about crime as a general principle, more than they are about it locally in their own neighborhood. That gap is present across every demographic and geographic subgroup. So it does seem to be something that's just sort of part of the mental framework with which Coloradans in general view these issues. And frankly, I think the same dynamic is evident in most parts of the country. Even if you are not seeing evidence of crime in your own community, you read about it in the news, you see posts on social media, there are things other than direct personal experience that may provoke concern. And it is much broader concern, as we see here. The gap is notably wider when we look at Asian Pacific Islander, Black, and Latino respondents. Their concern about crime in general is significantly higher than their concern about crime in their own neighborhoods. There is also a partisan gap on this issue. Republicans express far more concern about crime overall. We saw that a couple of slides ago. 80% view it as a very serious problem, whereas fewer than 1/3 of Republicans see it as being a problem in their own neighborhood. There's also a gap among Democratic and independent Coloradans, but it is not as dramatic. About half of Democrats and independents view crime overall as a very serious problem, and fewer than 1/4 see it as a problem in their own neighborhood. Finally, you'll see some differences here by level of education. Coloradans with lower levels of formal education without a 4-year college degree, more likely to view crime overall as a problem. But interestingly, there's not much variation in their perceptions of neighborhood crime by their educational attainment. Those with postgraduate education are the least likely to view crime as a very serious problem, fewer than half overall, indicating that it's a concern. So finally, to round out this discussion of overall issues, we had another open-ended question where we asked respondents to tell us in their own words what they saw as the most important things state government could do to improve life in Colorado. And as you'll see, the things they suggested very closely parallel the issues they identified as the biggest problems. A lot of their concerns focus on, or their suggestions for government action focus on affordability. In particular, housing affordability, having more affordable housing, limiting rents, taking steps to address inflation and the cost of consumer goods, whether it's gas prices or food costs, and then a range of responses relating to taxes, some calling for lower taxes, some calling for changes to the taxpayers' Bill of Rights, but modifications to the tax system, obviously something else that has financial impacts on Coloradans. Outside of the cost of living concerns, we saw suggestions that related to immigration, to expanding access to healthcare, and generally to having less government overall, limiting the role of government. All of those things the Coloradans suggested as potential solutions here. Most of what they suggested to us was not very specific. It wasn't sort of detailed policies or pieces of legislation that they were saying they were behind, but more just identifying, hey, here are the places that life in Colorado is challenging right now, and here are some of the kinds of steps we would like to see state government take to try to make it more manageable for residents of the state. So with that overview of major issue concerns, I'm going to hand it over to Lori, who's going to talk a little bit about a new set of questions we asked this year around community and belonging, and then some of the findings that relate to health issues as well. Lori?
Thanks, Dave. So I just love this set of questions. It's something we've heard about in other research we've done in focus groups over the years. In fact, I was just in Northern Colorado in a focus group, and this very topic came up. So it's lovely to have these data points to be able to point to now. So we asked people, first of all, we defined what we meant by a sense of belonging. You can see it right above there in the exact question language that people responded to. And we asked them how regularly they feel a sense of belonging in each of these types of places that you see listed out here. Of course, these were all randomized, so people were hearing them in different orders. People who were employed were asked about their workplace. Students, of course, these were all adults, so we weren't talking to teens or younger people, but again, people that were full-time students were asked about their school as well. But you can see most Coloradans do tend to feel like they belong in many of these atmospheres. So whether it was their home, which people were more often than not telling us that they felt like they always and most of the time belonged in that environment, whether it was a workplace, neighborhood, or in a more public setting on the streets, parks, businesses, or other public places in their community. 3 in 5 or more were telling us that they always or most of the time felt a sense of belonging. Notably for those students, since it is back to school time right now, they were a little bit more divided. About half of those adult students were telling us that they felt a sense of belonging in their school. But of course, some of the more interesting dynamics are really underneath this overall data. When we broke it out by different demographic subgroups, we can see a number of key distinctions here. Particularly, we would note that LGBTQ Coloradans felt somewhat less welcome than did other Coloradans, particularly in their neighborhood, where we saw about a 13-point gap. And out in the community as well, we saw some distinctions there. As well, disabled Coloradans felt somewhat of more distinction in terms of feeling a sense of belonging in their workplace, and again, out in public places in their community. We didn't see as great a distinction in some of those other areas. We'd also note that we've noted here a few other distinctions, but why were they feeling? Go ahead and move on. It's okay. Why were they feeling some of that sense that they might not belong? Notably, and again, people have heard so much about political divisions. We've heard people in focus groups tell us that they've lost friends, they've gotten disconnected even from family because of political beliefs, and that really dominated here as well. So among those who had felt that they didn't always belong, 2 in 5 pointed to their political beliefs as a point of division. About 1 in 5 pointed to age, and again, a myriad of other attributes or conditions that people have pointed to as something that maybe didn't make them feel like they belonged at all the time, but really political beliefs dominated in terms of what people were pointing to as a reason for division. If we go to the next slide, you can see that notably, one thing we'd like to highlight here, there's so many data points here, which is why you guys are going to see this great interactive tool to really dig underneath all of this. But age was one place where we saw that somewhat older Coloradans by 10 points were more likely to point to age as a reason that they sometimes didn't feel like they belonged, more so than young Coloradans. And then on race, we saw Black African American Coloradans or Asian Pacific Islander, and then Native American Indigenous populations more likely to point to race. The latter was also more likely to point to culture or background. So lots of reasons why people may not have felt like they always belonged. But again, political beliefs really dominated. And it was highest across party lines, more so than any other single attribute, but it was significantly higher among Republicans. So those who indicated that they were Republican, a majority actually said that political beliefs was something that made them feel like they didn't belong, significantly higher than our independent or unaffiliated folks. And then, by 23 points, it was higher among Republicans than among Democrats. So something where we're seeing more of a partisan distinction here in terms of the data than any other particular attribute that we looked at. We also asked a number of statements getting at belonging and asked people to tell us whether they agreed or disagreed and how strongly they did with each one of these. And we saw that for the most part, again, we had about 7 in 10 or more agreeing with those affirmative statements about belonging, that in their community, when they're interacting with other people, they feel like they truly belong, or that people in their community welcome and include them. We definitely saw a lot of agreement there, and almost 1/3 indicating strong agreement. When we framed it in a more negative way, that they felt like they were treated worse than other residents in their community, by and large, Coloradans 4 and 5 said that they disagreed with that idea, and most felt strongly about that, 63% indicating strong disagreement, that they had felt like they had been treated worse than other residents in their community. Of course, again, there are distinctions among various subgroups. On the next slide, you can see that, again, we would point out that LGBTQ Coloradans and those living with a disability tended to express less sense of belonging. And it was still a majority that responded positively to those affirmative statements about belonging, about 2/3 or more, even among those subgroups. But again, there was a clear distinction, especially among those subgroups of LGBTQ and disabled populations, that were more likely to say that they, or less likely to say that they felt like they belonged in those affirmative statements. We go to the next slide. We wanted to also dig into some of those mental health data points that Dave talked about earlier. Again, this is a topic that we've looked at over the years, starting in 2020. And you can see, remember, everyone placed themselves back in August of 2020. We got delayed a little bit in terms of fielding that, simply because we did have a global pandemic. We'd all been sort of locked in our houses for a long time. And it was a majority of Coloradans that were saying back then that mental health was an extremely or very serious problem. But it really took a year to sort of tick upward. And we saw in 2021 and 2022, we're at 63%. We bump up even further, over 2/3 of Coloradans in 2023 telling us it's an extremely very serious problem. So we've set back a little bit, about 10 points lower this year in terms of Coloradans telling us this is an extremely very serious problem. But again, it's helpful to place this in perspective. It's still somewhat higher than what we saw at the height of the pandemic in terms of overall concern there. And again, when you add in those saying it's at least somewhat of a serious problem, it's the vast majority of Coloradans that are still viewing it as a serious problem. And in fact, when we look at how that's affecting Coloradans, notably over the last year, we've had about the same number as we saw last year, about 1 in 4 Coloradans telling us overall that they postponed mental health care. What's really striking is just how broad this is. In fact, we're seeing young Coloradans, 44% of those aged 18 to 29 are telling us that they postpone mental care. That's why you see that heightened group among those that are still on their parents' insurance. But it's really a broad range of different groups that are telling us that they've really set aside and postponed mental health care over the last year. which is striking given how many Coloradans tell us on the next slide that they are experiencing mental health strain. As Dave alluded to before, we saw a majority, 59%, about on par with what we saw last year, telling us that in the last year, they've experienced mental health strain such as anxiety, depression, loneliness, or stress. Not shockingly, although the numbers are truly shocking, that has affected some Coloradans more than others. We see those that are searching for work, LGBTQ Coloradans, those young Coloradans again are far more likely, 3/4 or more, telling us they've experienced mental health strain. So significant proportions of the population are really telling us that this is something that's been affecting them. And in fact, it's 2 in 5 of these folks that have experienced mental health strain that say, yeah, I postponed mental health care. So not everyone is accessing care despite the fact that they're dealing with some of these problems. If we look at what Coloradans would most like to do about this, we actually forced people to choose among a number of different options this year, asking them to sort of place some priority on different options. 2 of those options talked about increasing government funding. So whether that was resources for local mental health services and facilities, or whether that was for mental health prevention programs and services and communities. Really, when you group those 2 together and contrast it with increasing the ability to use health insurance to pay for mental health services, we see that Coloradans are pretty divided between that idea of increasing government funding and resources or focusing on the ability to use health insurance to pay for mental health services. We definitely saw that when we look at those 3, the increasing the ability to use health insurance is something that across the partisan spectrum was a little bit higher priority for most, although Democrats were more willing to say we ought to increase government funding and resources for either of those 2 options. So then you tend to see that Democrats are more inclined to focus on increasing government funding versus independents and Republicans that were more apt to look at expanding the ability to use health insurance to pay for those mental health services. And then on the next slide, you can see that it really didn't matter what one's insurance status was. Even those who had a plan through their employer, through their spouse's employer, through their parents, they were still focused on that idea of increasing the ability to use health insurance to pay for mental health services. So that's really important to note that that was still a concern even for those who had health insurance. And then finally, we looked at those who had experienced mental health strain, which we saw was the majority of Coloradans again. Their priorities were about the same as those who had not, who at least said they hadn't experienced mental health strain. They were just more likely to pick one of these options and not opt out and say they didn't know. So I think they thought about it a little bit more, having had that experience, and really wanted one of these actions to be taken. So that is a lot of data. There's so much more. So I'm going to hand it back to Kyle to talk about ways you can interact with this data.
Thank you, Lori and Dave, and thank you all for joining us for today's discussion. I am Kyle Rojas-Legleiter. I'm the Senior Director of Public Policy at the Colorado Health Foundation, and we really appreciate the lively questions and chat we've been getting throughout today's webinar as well. Please keep those coming. We're about to move into the Q&A portion of today's conversation where we'll have a chance to dig into some of the things that you all are curious about. One of the things that we're not surprised to hear that there's lots of curiosity about is the ability to zoom in on particular themes in the data, whether that's a question that we asked about, a topic that we explored in this year's survey where you want to dig below the surface of what you saw in today's presentation, or if you're really interested in a particular subgroup of Coloradans, whether that's a group of people who share a common identity or lived experience together and really want to zoom in on the results of what we heard from those people. So before we move into today's conversation, we want to do a quick demonstration of a really cool tool that we've built on the Pulse website that's publicly available to all of you today and into the future that allows you to do just that, to zoom into particular questions and subgroups that are of interest to you. And for that demonstration, I'm going to hand it over to our friend Heather, who's going to do a quick demo of how to navigate that Tableau dashboard on the Pulse website. So Heather, I'll turn it over to you. And in the meantime, please keep your questions coming in through the chat, and we'll move to Q&A right after this demonstration.
Thanks so much, Kyle. It's such an honor to be here with you all today. And we're excited to give you the opportunity to really see and understand the data in ways that matter most to you or people you're advocating for, care about with that. So you'll go to the Colorado pulsepool.org website and click on results, and you'll get to the 2024 dashboard. And so what you'll notice, I'm going to go ahead and click on this full screen option. You'll notice that every single item within this dashboard is interactive and clickable. So these are all buttons that will take us to the internal dashboards to understand more of what's happening in each of those topics. You also can click on these specific areas if you want to go straight to housing or belonging or economic opportunity, which have been very big themes today. The other things that I want to talk about is that we have this all in English and in Spanish by just simply clicking on that button. That will allow you to then, whoops, let me try that again there, apologies. That will then change everything to Spanish for you, and you'll be able to work to see the dashboards in your chosen language of choice as well. So I'll click to English, and let's go ahead and go to challenges facing Colorado. We've spent a lot of time talking about that with Dave earlier, and then I'll take a little bit of time to talk about the things that Lori was showing you as well, and how you can start to dive deeper into these issues. So you'll notice right away that the rising cost of living and the cost of housing is showing that in this data as well. But let's say that you might want to look at this based on looking at a particular population, perhaps Hispanic and Latino. So if I click on the race and ethnicity, and you start looking at each of these areas, we have different demographics that you can then click on that allow you to pivot the data and bring in what matters most to Hispanic and Latinos. And you'll notice cost of housing is a bigger concern than cost of living when you start to look at the data through that demographic. We can add additional demographics when we do that as well, where I can say, well, what matters most to Hispanic and Latino by holding down Control or Command on your keypads. You can then click on those who are 30 to 39, and that will then change the data as well. Still, cost of housing is a large concern, but it's grown tremendously for those who are 30 to 39. So let's take a look at some of the other data. So what you can do is there's some icons at the bottom of your screen, and you'll notice this will reset the view, the icon that has the little arrow that goes back with a line there, that will clear all of the view that we were looking at. And let's talk about some of those partisan issues that we were seeing earlier that both Dave and Lori had touched on. And you can see if we look at Democrats, you'll start to see that these challenges facing Colorado change a little bit as well. That cost of housing is a big one, but here you'll see that increase in climate change. That's a concern. Smaller amount for illegal immigration. If I go to the Republican political affiliation, you'll notice that illegal immigration has increased quite significantly, but climate change is much lower. So these are those political divides that both Dave and Lori were talking about earlier that we can point out, and you can start to see this. So you can come to any one of these dashboards, choose the demographics that matter most to you and the populations that you work with and care about, and start to see how they answered those questions as well. Now that I'm in these internal pages too, I want to point out some navigation. Let's say that you want to understand how to explore this dashboard and you forget all the things that I just said. There's a question mark here. When you hover over that, it helps you understand how you can navigate the dashboard. So this is all designed to be interactive. Again, it's so you can see and understand the data that means most to you in a visual way. So most of the things are clickable on these. So click on them, click back on it again to clear it, or you can always go back to this icon to reset the view. You can click on anything to look at the legends, things like that that are in there as well. And so this will be a way to help you navigate. This takes you back to the index page where we first started. And this little hamburger menu, when I click on that, this takes you to each of those different areas. So one of the other areas we focused on today was sense of belonging. So let's go ahead and click on that. This now takes us to the sense of belonging dashboard. You'll notice we have two sets of questions. There's one that we're on page 1. We can also go to page 2 on that as well and see what's happening with sense of belonging. So when we look at this, you can see most people, as Lori covered, feel a sense of belonging in their home and in their neighborhoods. In the streets and parks, it's a little bit less, but also in their workplace. So home, neighborhood, and workplace, you can see that. As you start to look, though, we were talking about LGBTQ plus. If we look at gay and lesbian and I hit control and click on bisexual, I can add that to the mix. You can see many of them feel a sense of belonging in their home, but not as much in their neighborhoods, certainly not in their parks, and less in their workplaces. And you can also see that difference between LGBTQ plus students, that it's a lower sense of belonging as well. I can clear that out by clicking on each of those a second time. That will remove the gay and lesbian. That will remove bisexual respondents. And now you can see which of the following were things that made you feel like you did not belong somewhere. That political beliefs situation that was covered earlier, that this is one of the biggest divides. And as we look at this and dive deeper, we can go back again to political affiliation. If I click on Republican, that moves from 40% overall to 54% of Republicans saying that that's the case. If we look at Democrats, that's lower than the overall 40% that was there as well. So you can do this with any of the things that matter to you. So if we want to look at the next part for the sense of belonging, these are the other questions that we were looking at with that, and looking at how often do you feel a sense of belonging in each of these places. We can also go into looking deeper into healthcare and mental health. That was another area that we talked about today. So as I navigate, again, clicking on that hamburger, going to the dashboard, the healthcare and mental health dashboard, you'll notice there are two sets of questions. So we can also look at these demographics and some of the areas by the region that we're talking about. So if we're looking at healthcare and mental health and we want to look at Colorado Springs, you'll notice that if they're thinking ahead over the next year, how worried are they that you or someone else in your household will be without health insurance? That increased to 36% here. If I remove Colorado Springs from that, that actually decreased to Colorado Springs. It increased to not at all worried there. If we start to go into the Western Slope or the Eastern Plains, I can also start to look at regions and see how that changed. And you'll notice that this increased quite a bit to somewhat worried about someone in their household being without health insurance. So you can start to dive deeper each time you click on these, and you can again click on the one that you had or click on the icon to reset all of the pieces that are there as well. So looking at healthcare and mental health, we can see the areas of questions that were asked, and we can start to note here in the last year, have you experienced mental health strains such as anxiety, depression, or loneliness or stress? You can see 60% of our respondents did that. If we go deeper into age and look at those 18 to 29%, it's 78% that we look at. So all of these items are clickable. All of these allow you to dive deeper. Again, they're listed in English and in Spanish. So you have both options that are there. And then what you can do as well is you can move on to trends. So if we start to look at the trends in the data, we can go here and look at some of the things and how they've shifted over time. Now, the sense of belonging questions were just asked for the first time this year, so you won't see trends with them, but we can look at things like the rising cost of living. When you click on that at the top of the screen, you can start to see extremely serious has dropped with cost of living, but it has increased and not too serious. And you start to see these trends and patterns over time. We start looking at things like climate change and how those have increased over time. You can start to see each of those trends and patterns in a visual way as well. So again, everything is clickable. Everything is available to you in both English and Spanish. You can always get back to this homepage to navigate where you'd like to go and ask the questions that matter most to you, the people you care about or advocate for. So Kyle, that's about all I have planned for today, unless someone wants me to dive deeper into anything with questions. So I'll hand this back over to you, and I'll be happy to bring it up in the Q&A.
Great, thank you so much, Heather. We're going to bring back Dave and Lori from the research team for today's Q&A portion. And again, thank you all for the great reflections, discussion questions you've been entering into the chat. The window to do that is not yet closed, so please keep those coming as we move into today's discussion portion as well. And I'm going to start out with a few sort of informational clarification questions that we got from folks throughout today's presentation. One, just a quick housekeeping reminder, both the dashboard that Heather walked you through is already available on the Pulse Poll website, and we've shared that link in the chat, and we'll share it and follow up with you all in email after today's webinar as well. And that is not the only way that we've made available to you to look into the results of this year's Pulse Poll. We also have the data available in other shapes and forms to make it user-friendly depending on your preferences. So if you're somebody who likes to look at data tables or questionnaires and those kinds of things, we have all of that stuff and those ways of looking at the data available on the Pulse website as well. A quick sort of note about what you saw on the data slides that Dave and Lori walked through as well. At the top of each of those slides, we put the verbatim question as it appeared to respondents of this year's survey. So if you're curious about the frame of the question, the specific language that people are responding to, that is embedded in each of the slides that you saw today. And again, this slide deck will be available to you after today's webinar as well, so you'll have a chance to look at that in greater detail as you do that. One of the other questions that we got was whether or not some of the numbers that you saw on the data slides were percentages or raw numbers of respondents. All of the numbers that you saw on today's sort of data slides are percentages of responses as well. So thank you for folks who've asked for those clarifying details. One of the other sort of more general questions that we got was if we have any way of looking at why people feel a certain way that they did. And this sort of came in as we were walking through that battery of concerns, what people were sort of naming as their top concern for Colorado in 2024. And then the series of questions where we prompted them to think about specific issues in Colorado and invited them to tell us whether or not they thought a specific issue like gun violence or climate change or mental health was a serious problem in Colorado. And Dave and Lori, I'm wondering if you could share a little bit about your reflections about some of the why and what we can know from this data and some of the things that we can't know from this data and Pulse.
Yeah, it's a good question, and it's one we often get in survey research. When you ask a question and get an answer, it often prompts a follow-up question where you want to know more information from the respondents. And unfortunately, in order to get data from as many and as diverse a set of Coloradans as possible, we have to keep the questionnaire relatively short. We can only keep people for about 20 minutes worth of answering questions. And so there just isn't a lot of room for follow-up questions to ask people why they think what they think, as interesting as that would be. We did have a handful of questions in here that were open-ended, where people could tell us what they saw as the biggest problem facing the state, what they most wanted state government to do about it. And I think from those questions, we can sometimes read into a little bit the experiences and values that are driving people's perspectives. I will also say both Lori and I also do lots of other research in Colorado for other clients, which has given us the opportunity to hear some of those rationales and thought processes that Coloradans may be going through. So if any of you have questions about a specific issue area in the poll, we're happy to share what we might be able to glean from our other research that might shed some light.
Thank you, Dave. And for us at the Colorado Health Foundation, we really do think about Pulse as an exercise in listening to different people around the four corners of Colorado. It is unfortunately a shallow conversation with people. As Dave mentioned, we get to ask about a range of different topics, but it is limited in our ability to sort of see below the surface. So we tend to describe Pulse as a mirror that reflects what people are thinking, what they're experiencing, what life looks like from their point of view in Colorado. And like a mirror, it reflects what's on the surface and is limited in its capacity to dig deeper than that. But one of the powers of Pulse, particularly with the large sample size that we have this year and in every year that we've done the poll, is the ability to detect certain patterns in the data as well. So do we find that certain experiences or perspectives are more common, more prevalent in certain groups of people compared to others? And so that brings us to a question along those lines that we got when we were hearing the data from this year's section they explored this topic of belonging for the first time on the Pulse poll. And question that we got in that regard was, did the data show a correlation between a lack of a sense of belonging and what people told us about their experiences with mental health? And Lori, I'll put that question to you.
Sure, absolutely. It's a fabulous question. We do see a relationship between those who are experiencing mental strain and how they responded, especially in some of those agree-disagree questions I talked about. So, for example, and it's still a significant proportion, but 68% of respondents who said they felt mental health strain indicated feeling welcome in their community. It was 82%, so a higher number that said if they had not experienced mental health strain, that said they felt welcome. We saw about the same dynamic, about a 12-point gap on truly belonging when interacting with people in their community as well. So there's definitely a relationship, but it's not night and day. It's just sort of degrees of feeling belonging if they're experiencing mental health strain.
Thanks, Lori. At the beginning of the data slides, we were sort of reflecting what we heard from Coloradans in terms of top concerns in 2024 and their perception of whether or not certain issues were serious problems in Colorado. We got a few comments around sort of the wildfires, climate change, natural disasters, and some sense of surprise about a drop-off in the level of agreement this year compared to previous years about that. And some reflections of, could that potentially be a reflection of the timing of this year's survey? So as a reminder, we were in the field for Pulse this year in late May to late June, so shortly before the recent outbreak of wildfires along the Front Range in our state. And Dave and Lori sort of spoke to, they've had a long working relationship across their two firms, not just with Pulse, which dates back to 2020, but I know that you've also done a partnership with Colorado College where you explore environmental and sort of climate issues in Colorado and other Western states for a number of years now too. So wondering if you could just share a little bit more about some of the patterns that you've seen over time in survey research about how people respond to issues around wildfires, natural disasters, and climate change.
I guess the first thing I would note is that the place where we really saw the decline in people talking about wildfires and climate change was in the open-ended question where we asked people to name the most important issue facing the state. So they could only mention one thing. As we noted, Coloradans are concerned about many different things at once. And so when you force them to pick one, they tend to focus on what has been getting sort of been most immediate in their own lives or what's been getting the most attention in the news. And as you noted, at the time we did the survey, wildfires just weren't as present as perhaps they had been in previous years. But later on in the survey, we do see that there is still robust concern about the risk of wildfire in Colorado. And as you noted, Lori and I have done lots of more in-depth research on this topic, both in Colorado and around the country. Over the last few decades, the level of concern about wildfires has dramatically increased. And even in years recently where the fire season itself has not been as bad, that concern may diminish slightly, but it doesn't go away because the public understands this is a long-term structural problem that we're going to be dealing with for the foreseeable future. So overall, I'd say, yes, some metrics show a little dip in the attention the public was paying to the issue earlier this year, but fundamentally, it hasn't been a dramatic shift in their overall levels of concern.
Thank you, Dave. Another question that we got in from the chat while we were sort of seeing the results this year on the theme of mental health and sort of people's experience with insurance was if we know anything more about what specifically people want from health insurance in Colorado. Is it a wider network, more visits, or something else? A note on that sort of general theme, every year in Pulse, we sort of keep certain questions so that we're able to track trends over time, and that's some of the data that you saw in today's presentation. We're able to look at how 2024 and what we heard from Coloradans this year is like or not like what we've heard from Coloradans in every year. But that also means that we don't necessarily repeat questions of all of the questionnaire every year too. So each year we do a deeper dive on a handful of topics. We didn't do a deeper dive on insurance related questions for the large part in 2024, but we have asked about people's experiences with health insurance, and particularly their ability to use health insurance to navigate access to physical health care and mental health care. So Dave and Lori, this may be a bit of a blast from the past, but if you can think back to some of the years where we've asked a deeper set of questions about people who reported not seeking, delaying seeking mental health care or physical health care, and some of the reasons that they told us about what was standing in the way of seeking timely healthcare services, what were some of those themes that we've asked or heard from people when they talk about their experiences navigating the healthcare system, even though we didn't do a deeper dive on that this year in Pulse?
Yeah, I'll just note that really cost has been the barrier. And so whether that has been there's limits on how many visits that insurance will pay for, or that they can't access someone they're comfortable with because they're out of network and therefore the costs are going to be significantly higher. It has basically come down to cost is what we've heard a lot about. So, you know, it could be any of the myriad of things that were touched on in that question. But I think the main barrier that respondents have told us about is just simply the ability to pay and hoping that insurance can cover more in various ways so that they can access care, whether that's physical care or whether what we saw this year where they postponed mental health care. So it comes down to money, unfortunately, in most cases.
Thanks, Lori. We got another question sort of reflecting on sort of the theme of the first release webinar that we did last month. Really drilled into what we heard from Coloradans this year around that top concern about the cost of living generally, and then the cost of housing specifically in Colorado, and sort of reflecting that that tracked with what this sort of listener was seeing and hearing in their own community about this rising cost of living in Colorado, and wondering if we have any information about the level of support for rent control in Colorado. And that is, to my knowledge, not something we asked about specifically this year on the Pulse poll in 2024, but I believe that we have explored that when we've done deeper dives on housing policy solutions in previous years of Pulse. So I do want to note that all the sort of data that you've seen available and the different ways of looking at this year's data on the Pulse website is true for the 2024 data, as well as all the archives of the data that we've gotten from Pulse in all 5 years of conducting this survey as well. So we do have deeper information about what Coloradans think about different housing policy solutions, including policies that might impact renters specifically in the 2023 data, as well as the 2022 data from the Pulse poll. We're getting a lot of questions with people really curious about what we can sort of learn about specific subgroups of people in Colorado, whether that's racial and ethnic subgroups, geographic subgroups of people in Colorado. And some of the questions are informational ones. So is there a way of looking at the number of respondents that we have for a particular group of people? So for example, the number of respondents who said that they live with a disability or live in a particular part of the state. Dave and Lori, I believe that that information is available. And so I wanted to invite you to talk about where folks can find some of that more granular information.
Yeah, yes, it's all available on the website. You'll be able to see cross-tabulated data for the poll, which breaks out all the responses by different subgroups within the Colorado population, and it'll show you the number of respondents who fall into each of those categories. You can also see the top line results of the poll, basically the questionnaire filled in with all the percentages that chose each of the response categories, including demographic questions, which will show you the percent of respondents who fell into a number of the different categories folks have expressed interest in. So all of those tools or all of those sort of raw data points are available in addition to all of the great analytical options that the Tableau gives you.
One of the subgroups that seems to be of particular interest to people is local level data or regional level data, so the ability to zoom in by geography in Colorado. You got a sample of that, of what's available on for Pulse data in the sort of walkthrough of the Tableau data dashboard, as well as some of the slides that you saw in today's conversation that talked about regional breakdowns of the data, where you're able to sort of see where we did see differences or similarities across geography in Colorado. A little bit too much detail to cram into the dashboard itself or onto the slides, but we do also have county level specific data for some of the largest counties in Colorado as well. I believe this year, with the sample size that we had, it's about the 11 or 12 largest counties in Colorado. We have a large enough sample size to be able to report with some confidence county-specific data for those counties as well. So if you're interested in that, you'll be able to find that on the Pulse website soon as well. So that includes all of the Denver metro area counties as well as other counties along the Front Range. So if you're interested in a specific county, there will be ways for you to sort of drill into that information as well shortly on the Pulse website. Related to these sort of subgroup questions and sort of diving into specific populations or sort of groups of Coloradans, we got a few questions in the chat around sort of this concept of margin of error. And Dave, at the beginning, you sort of talked about the overall margin of error for the survey, but people are also wondering about the margin of error for some of those specific populations that we're able to zoom into. So two-part question for you, Dave. First of all, what is a margin of error in a non-jargony way of thinking about that? And then two, how is that different for the overall results compared to some of these subgroups that we have the ability to zoom in on?
Yep. On a high level, when you hear about the margin of sampling error in a poll, it is a way of expressing one of the different types of error that can creep its way into survey measurements. And it's the error that comes from the fact that we are not doing a census and speaking to every single adult Coloradan. We're selecting a random sample of people to talk to. And by chance, the random sample of people we talk to may be somewhat different than the underlying broader population in terms of what they think about the issues we're asking about. Statistical theory tells us that if we have a large enough sample, and we do this multiple times, we can estimate roughly how different the results could be from what we would get if we interviewed every single Coloradan. And so because we interviewed over 2,400 residents of the state, we know that our margin of sampling error is plus or minus 2.9%. So if we kept doing polls of 2,400 Coloradans, 95% of the time, the results of the poll are going to be within 2.9% of what we would see if we talked to everybody. That's what the margin of error tells us. It's basically just an estimate of how precise the survey is, how much the random sample of people we talk to might differ from other Coloradans. The smaller the subgroups you look at within our sample, the larger the margin of error would be. If you talk to fewer people, the chance that just by the random selection of folks that you talk to, their views are different than others in the population from which they were drawn, it goes up. Just as a rough rule of thumb, if you look at a subgroup of 100 people, it's going to have a margin of error of roughly plus or minus 10%. Compared to the 2.9% we get for the 2,400 that we interviewed overall. The smaller the subgroup you look at, the larger the margin of error, just as a rule of thumb. So if you're interested in looking at some subgroups, by all means reach out. We will tell you if the particular subgroup you're looking at is so small that the margin of error is so high and we can't speak with confidence about what we learned. But for many of the racial and ethnic and geographic subgroups that folks have asked about in the chat, we have a robust sample of respondents, and you'll be able to see those breakouts both in Tableau and in the data on the website.
And I'll just underscore, Kyle, that this is a very significant number of Coloradans that we speak to every year. So unlike a lot of surveys that you might see mentioned where we've spoken to 500 or 600 Coloradans to represent all Coloradans, this survey in particular gives us the ability to look at some of those subgroups. And so it is really a credit to the Colorado Health Foundation that they've invested in being able to look at these individual groups that I know so many of the folks here are talking about, really wanting to dig into the data with those particular populations.
Thanks, Dave and Lori. One of the questions we got was specifically for us at the Colorado Health Foundation, and it was whether there were things we saw in this year's data in 2024 that surprised us. And, you know, as I think about now 5 years worth of experience doing polls dating back to 2020, you know, that's a really interesting question to reflect on when I think about both this year specifically, but then also some of the overall sort of changes over time that we've seen over that period. And at a top line level, as I said, we think about Pulse as an active listening, but not the only way that we are engaged, that we listen to Coloradans in various shapes and forms across Colorado. So in some ways, when I think about what we heard as sort of the overall top concerns in Colorado, and when we sort of ask people specifically about their reflections on a particular set of issues and whether or not they think that there are serious problems in our state, in large part that tracks with some of the overall trends and patterns that we're hearing on the ground when we travel across Colorado. So for example, it wasn't necessarily a huge shock or surprise to us at the Colorado Health Foundation that the overall sort of top concern that people said in that open-ended question this year was something related to the cost of living or the cost of housing specifically, because that very much seems to be on the tip of the tongue of just about everybody here in Colorado. But one of the things that, as I've sort of spent more time with the data this year, that I've really been reflecting on is, that seems to be a conversation that many people are having in Colorado. But then when I think about some of the things that we have asked about in various shapes and forms over the years of Pulse, like mental health, one of the things that I think about is, it's not necessarily like the top level issue that people are naming first on the list anymore in 2024 in Colorado. But I also hold that with some patterns of what we've heard about people's experiences with mental health over time in our state. So it's been consistent over the 5 years of Pulse that a majority, a plurality of adults in Colorado tell us that they themselves are experiencing some type of mental health strain or challenge in every year that we've talked about Pulse. And in many years that we've done Pulse, we've also asked follow-up questions of those folks who report having those types of experiences about who, if anyone, they're talking to about those experiences. And every year that we've explored that element of their experience, we've heard from folks that, yes, this is something that I am personally challenged with, or I'm worried about different folks in my household, parents of children, for example, they're experiencing mental health strain. But a significant proportion of them also tell us that they're not really talking to anybody about those concerns too. So that's one of those things that we sort of hold in our analysis and sort of our look at this too is, what are the things that people tend to be talking about a lot? And what are some of those things where, when we look deeper at the data, may be common experiences for all Coloradans or among particular groups of Coloradans, whether that's by race and ethnicity, income, geography, disability, or other types of ways where people might not necessarily be talking about those things quite as openly as they're talking about the cost of living, the cost of housing right now too. And so that's part of the way that we use Pulse as an active listening, but also a way that we use it to help us to better understand what we should be curious about and be listening even deeper and even harder for, because they may be things that people might not be talking about quite as readily as they're talking about the cost of living and the cost of housing in 2024. Some of the other questions that we're getting in the chat are sort of, continuing on the theme of curiosity about the experiences of particular groups of Coloradans, whether that's by geography, race, income, different ways of looking at the data this year, is whether or not folks can have a deeper conversation with us. In the years past, we have done special briefings where we've done deep dives on what we've heard from specific groups of Coloradans, whether that's the Native American and Indigenous Coloradans, and sort of zooming in on the experiences of those respondents in particular, Asian American, Pacific Islander Coloradans, different geographies in Colorado. What you saw today in today's webinar really is the tip of the iceberg. There is a lot of information and lots of ways of looking at this data. And we love talking about that with people because your questions, your curiosities help us to better understand and to see things in this data. And we really see this as a jumping off point for conversation rather than an end of conversation for us as well. So I put this in the chat already, but if you, your organization, community groups, or partnerships that you're a part of would like a specific briefing or conversation focused on a particular topic. So if you're really curious about, say, the belonging data and what we heard about this concept of belonging in 2024, or if you're really interested in the experiences of LGBTQ+ Coloradans, for example, feel free to reach out to me. I'll put my contact information back in the chat shortly. And we're happy to sort of schedule those follow-up conversations, those deeper dives on the data, if that's of interest to you, your organization, community partners that you're working with as well. So happy to be in partnership and in further conversation with you all, because again, that helps us also to develop a deeper sense of what we can learn from Coloradans from the Pulse survey. I believe that we are coming up on most of the questions we've gotten through in the chat. So I do want to note one other upcoming opportunity for us to do a deeper dive that's already scheduled. So Dave, if you click ahead to the next slide. One of the things that we've done in recent years with Pulse is it is not a single issue poll, and there is lots of different ways of looking at this information. So we've taken a phased approach to doing these big public releases to help it be a more manageable amount of information for people to absorb in one sitting. So last month we did a deeper dive on what we heard about those top concerns from Coloradans in 2024, so issues related to the cost of living and the cost of housing specifically. All of the resources and information that we shared in that sort of phase 1 initial release are available on the Pulse website already. The information, the slides, the recording, the other stuff from today's conversation will be up on that website shortly as well. And then we have another phase release coming up next month in September, where we'll do a specific deep dive into what we heard from Hispanic and Latino respondents in Colorado, what we're hearing from that very diverse community in particular. And that will be in September in a briefing that will be presented in Spanish language with live interpretation into English. So if you are interested in that deep dive into what we heard from Latino and Hispanic people living in Colorado, please join us for that webinar on September 9th. And then Dave, if you click ahead to the final slide. Thank you again for joining us for today's conversation. As I mentioned, we hope that this is the beginning of many conversations about this. We're happy to share as many ways of looking at this data as possible. So if there is something that you think is of interest to you, partners that you're working with on the ground as well, feel free to reach out to us to explore the information and the resources that are already available, like that incredible dashboard that Heather walked us through on the copulsepoll.org website. But also feel free to reach out to me directly if you'd like to request a particular conversation, briefing, deep dive on the data as well. Happy to be in further conversation with you all. But we very much appreciate your time today, and thank you for joining today's webinar. Thank you.